Hi, welcome to a new episode of The Edge, and I'm your co-host, Cole Szymanski.
And I'm Tess Piscatelli. The Edge is a show about topics teens typically tend to struggle with. Over the past year, suicide has become the second leading cause of death in teens ages 12 to 19. No family, friend, or loved one should ever have to go through or witness such a tragedy.
There are ways to prevent suicide, though. Approximately 76% of teenagers turn to a friend in the time of need. Friends of people that are struggling with suicide and mental health can be incredibly influential to those that are suffering. Sometimes a friend is all that you really need. Today, we are joined by Miss Jennifer Sakura, who is the area director of the American Foundation of Suicide Prevention in Western PA. She's been working with the AFSP since 2010.
Yeah.
And has worked tirelessly to help 20 counties all over Western PA.
Yeah.
So, welcome, Jennifer.
Welcome. Thank you very much, Cole and Tess, for having me.
Thanks for coming. It means a lot.
Yeah.
So we'll just get right to it. Why has suicide became such a big problem within the past years?
Well, we're definitely concerned with the rising suicide rate over the past 15 or so years. It has been edging up slightly every year. Really, at the root of most suicides, 90% of them have been attributed to a mental illness or mental health condition. I know when I lost my sister Chrissy in 2001, she had been long suffering with severe depression for many years, and she abruptly stopped her treatment, and that was a very bad decision that she made, and unfortunately she died. So we know that mental health is a very strong component with this, and that's something that we're very much keeping a close eye on and trying to raise awareness and educate people about the mental health factor here, even among teenagers.
Yeah. So mental health is obviously a factor. What are some other factors that?
Yeah, so mental health is not the only explanation. It's definitely a factor, but most, in fact, 1 out of 4 people will have a mental health condition in the course of their lifetime. That's a lot of people. But most of them will never have thoughts of suicide, much less engage in suicide behavior. So there are other things that can happen with a person that might think of it as piling on, right? Is the more things that pile on, the more risk factors that are present, the stronger the likelihood that suicidal behavior or thoughts might start to creep in. So those different risk factors might include health conditions outside of mental health, if somebody's dealing with some other type of serious health issue or chronic pain or an injury or something like that, concussions we're hearing more about. Another health risk factor might be things that are going on with that person's family history. Maybe that individual has suffered from abuse of some point at some point in their life, or some type of an assault. Maybe there are mental health conditions that run in the families, or even suicides that have occurred within the family. So those are some examples. And then another area of risk are what we call environmental factors. So we hear a lot about bullying and online bullying, or just the stresses and pressures of life, right? For high school students, you guys are under a lot of stress to pick what college am I going to go to? Am I going to get into the college that I want to get into? So those pressures and relationship stress, and again, the more things that pile on, the more the risk.
So then how can you tell the difference between whether it's just a lot going on or whether a person has depression?
That's a great question, Cole. I think, if you're caring about a friend, if you're concerned about a friend, you probably know the baseline for that friend, right? Like what's kind of normal for that person. If you start to see that things are changing for that person, those can be a strong signal that it is time to have a conversation with them. In yourself, if you're starting to feel or experience thoughts of hopelessness or despair about the future, or starting to feel like you're not worth anything, those are signs to look for in yourself. So there's 2 different things we're talking about here. Are you talking about a person who is concerned about themselves, or looking outward at friends or people they know?
Okay. So if we're looking outward with friends or people they know, how would someone bring that up to their friend? Because that's very difficult.
It is difficult. It's awkward, right?
Yeah.
And Cole mentioned a statistic that we have, which is that 76% of teenagers and young adults are more likely to talk to a friend about their mental health than they are about a parent or another trusted adult. But those can be very awkward conversations.
Yeah.
How do you talk to somebody? One of the things that we recommend is just ask. Your job as a friend is not to diagnose them or to try to treat them. It's really just to have that conversation and just tell them that you've noticed. I've noticed this change in you. I'm concerned. Do you want to talk about it? Maybe they don't want to talk about it right away, but you've opened the door. And keep asking. It's okay to keep asking. You don't want to nag them, but you do want to keep letting them know you care.
Yeah, with that, like you just said, that you don't want to keep nagging, how do you know whenever you get to the difference of just making sure they're okay, or that you start to bother them with how much you start asking them?
I think as long as you keep telling them, these are the things I'm noticing, and I'm concerned. I'm concerned about these things. Are you sure you don't want to talk about it? If you are really concerned, this can also be awkward. Definitely tell an adult about what you're seeing with that person. Don't just keep it to yourself. If you continue to be concerned about that person, talk to a teacher, talk to the guidance counselor. If you can, even talk to that person's parent, because you never know if there's more going on there than what you're actually seeing. So.
And how would you say these situations get to the point where it's awkward? Because I know if a friend's upset, you don't really want to get involved in their personal life, but you still want to make sure that they're okay. How does that create an awkward situation?
Yeah, and maybe some people are more comfortable with having these conversations than others. It can become awkward if you know for sure that person is having struggles with their mental health. If they've maybe talked about that they're feeling depressed, or they're feeling anxious, or they're not feeling quite like themselves, it can be easy to just say, oh, they're just having a rough day, or I don't want to bug them about that. I don't want to feel like I'm intruding on that. But most people need people to talk to. It's very important to have people who have your back and who are supporting you. So I think if you're not feeling awkward about having that conversation, that's fantastic. If you are feeling awkward about it, we have a campaign called Seize the Awkward. You can check it out at seizetheawkward.org. Embrace the awkward. That's what it's all about. It's better to have an awkward conversation than to regret it later. Yeah.
So I don't want to intrude whenever I'm asking them about it. And if I tell a parent, what if my friend gets mad at me, or our relationship isn't the same? How would I deal with that?
I know, that's a tough dilemma, Tess. It's that could happen. Let's be realistic. It could happen. We've heard many situations where young people have talk to somebody else about a friend that they were concerned about, and they were worried about that risk. Is that going to alienate that person from me? Are they going to separate from me? That is a far better outcome than the outcomes that we're talking about today, which is suicide. So you could save a life even if you don't save that friendship. It's more important to save a life.
It is.
So like Tess just said, that she's worried about her friend getting mad at her. What are some ways that you can ask your friend if they're okay with trying not to intrude on their...
Yeah. And seizetheawkward.org actually gives you a bunch of different ways to start that conversation. So there's really no bad way to start that conversation, with one caveat. I will say probably a thing you don't want to do is say, I think you are bipolar, right? So you don't want to do that. It's better to just say, I'm noticing these changes in you. I'm concerned. Do you want to talk? I'm here for you. I'm worried about you. Is there anything I can do to help? And know your boundaries. Your job is there to be a great support, a listening friend, a caring friend. You are not there to be their therapist. But they may want to talk a lot, but encourage them to get the help they need, right? If you are determining that that person is struggling, really kind of also encourage them to talk to a professional, not just you. You can continue to be there for them, but you're not their therapist.
Yeah.
So then, how vital is it to get past the awkwardness of the first step? Because if you're asking a friend, it is going to be very awkward, but it's also more important to get past that first awkwardness.
It is, and I think you'll be surprised that people, will open up and they'll be gracious and grateful that you opened that door. So yeah, getting past that first step and opening up that conversation is really important. But as I had mentioned, the next step is to encourage them to get the help that they need, because this is very treatable. The issues that we're talking about here, there is help available. Treatment is very effective for almost everybody. So the next step is really to encourage them to get that help that they need and not to feel ashamed of it and not to feel stigma around that.
So you would say it's more important for the other person to start leading the conversation. So you open the door to them, and then once that door is open, they walk through and lead the conversation. Now, why is that?
Well, sometimes in many cases, a person who is struggling is kind of in their own zone, so to speak. They're experiencing a lot of what we call psychological pain, and they can become very focused on that pain. And as that happens, the world kind of starts to close for them. And the options in life, they don't see them like somebody else might see them because they're so focused on their struggle. So you might be a way to help them see that there's more they can do than just focusing on their pain, that there are options for them for getting help, because they might not be thinking about getting help at that point. They might just be thinking about, I'm in all this pain, it's never going to change, this is terrible. And then they start to go to thoughts about, how do I escape the pain? And that's when thoughts of suicide can start to creep in. So having that awkward conversation, you could be the one that kind of helps pull them out of that and start to see that there is a way for them to start to get out of this situation rather than to consider suicide.
So whenever we're having this conversation, we should more listen instead of giving them advice?
Correct. Yeah. You're there to listen. The only thing I would add to that is encourage them to get help. Right. Encourage them to get into treatment. And so listen and encourage them to seek help. Those are the two things that your role as a caring friend would be.
Now, what are you looking and listening for whenever you know something's wrong with your friend? So what are some of the warning signs that they will give you?
This is great. So there are 3 categories of warning signs that we have. The first is a way a person talks, and that could be verbal talk, or it could be the type of communication they're doing on social media. So verbal talk can be anything that ties into hopelessness for their future, that they want to die, that they see no end to their pain, that life isn't worth living. Nobody cares about me. Nobody wants me. I'm no good. So any of those types of statements that are making them feel just miserable about their future, miserable about their existence, those are things to look out for. On social media, you might notice changes in the type of content that they're sharing. It could start to go to darker themes. They could share content about other people who are dying by suicide. They could be making statements that are very straightforward about how they hate their life or things like that. So pay attention to both verbal as well as social media. So that's one category. Okay. Behaviorally is the second category. We can see a lot of changes in the way a person behaves. Can you guys think of any off the top of your head?
Just usually if your friend's always happy and always the life of the party, then they just kind of come away from everything.
Yeah.
Or like more impulsiveness
Yeah.
than
Yeah,
before.
those are two excellent examples, especially things that we see in young people. The behavior that Cole, you just mentioned, is really a kind of detachment behavior.
Yeah.
So they start to become withdrawn and start to isolate themselves. They might stop engaging with their friends, stop different functions or activities that they enjoy. They might even start to disengage with their schoolwork. School performance can decline, things like that. And then Tess, you had mentioned impulsive behavior. In young people, sorry, your brains aren't done cooking yet. So the frontal lobe, which is, you have an additional risk factor there, controls impulsive behavior and risk-taking behavior. So not only are you guys more likely to take risks and act on your impulses, you combine that with thoughts of suicide and you have a pretty deadly combination. So looking at impulsive behaviors, maybe they're taking more risks with criminal acts, social activities, relationships, things like that. Definitely be on the lookout for things like that. You might also see changes in the way they dress, the way they take care of their appearance. They might start to not take good care of their appearance. You might notice weight changes. They're eating more or eating less, things like that. So those are some examples of behavior.
Okay.
Yeah.
All right. And when we come back, we'll talk more about suicide prevention.
We're the stronger than we look type, the braver than you think type, the type that knows the time will come when we put type 1 behind us. We're the progress is inevitable type, the hopeful for a cure type, the type that will stop at nothing until type 1 becomes type none.
And we're back with our episode about suicide and prevention and with Miss Sikora. And so we've talked about how to help a friend, but we haven't talked about ourselves. And if we are dealing with suicidal thoughts or thinking about it, how should we know if it's like we're having a bad day or if we're just depressed and we need to get help?
Yeah, that's a great question. And fortunately, I can speak from personal experience because not only did I lose my sister to suicide, but mental health conditions have affected me as well. And I've struggled for a long time with depression and anxiety. I can tell you that if you're our good rule of thumb is 2 weeks or more. Everybody can have a bad couple of days. Yeah. You might even have a really bad week, right? But if your mood, if you are having a down mood or you're feeling anxious or you're feeling even super amped up and just not yourself, and the good rule of thumb is 2 weeks or more, because after 2 weeks, if you're still feeling that way most days, there probably is something going on that needs to be evaluated. Hopefully there's nothing serious, but we want to make sure that that person gets evaluated. So if you're having those feelings and you're just feeling low energy, you can't get up and get excited about things you used to, you're struggling with your life, you're struggling with thoughts, really negative thoughts, then that's a good time to get evaluated.
And how do you seem to talk to people about that if it's about yourself?
It can be hard. I'm going to be honest. I mean, a lot of people don't want to admit that they're having those types of feelings, especially if you're a strong performer, right? Or people have high expectations for you. You might be worried about disappointing people. The thing to think about with mental health, the word health is in there for a reason. And if you were having, let's say, for example, chronic stomach pain for 2 weeks, would you say something?
Probably, yeah.
If you were having migraines for a couple of weeks, right? So the same is true here. If you have any type of something that's making you feel physically not right and it's affecting your thoughts, then it's okay to talk to people and say, I'm just not feeling healthy. I'm not feeling myself. And that act of talking to people about that can be life-saving for you in the long run, because these illnesses, these mental illnesses like depression, anxiety, they can get worse over time if not treated, and then that worsening can lead to thoughts of suicide. So it's always better to speak up if you're feeling those things.
And why do you think you might not want to admit that you have these suicidal thoughts or depression?
Yeah, I mean, I think, again, you're embarrassed, right? People will think less of me. People will think I'm weak. You know, we hear men all the time, or males talk about how they just feel like they are supposed to be tough all the time and just tough through things.
Or like people feeling sorry for you, or like,
Yeah.
I feel like I'd not want people to do that.
Yeah. So there's a very strong stigma still out there around mental health. But I think it's changing. We're hearing about a lot of celebrities now who are coming out about their struggles with mental health. I'm sure you guys can think of some off the
like
top
I know
of your
on
head.
that Seize the Awkward website, there's 4 celebrities or 4
Different
pretty well-known
YouTube
people,
stars. Yeah.
that just came out and told their story about
Yeah.
how an event that was so tragic ended up causing this depression and suicidal thoughts, which I mean, I guess they're just trying to help.
Yeah, I mean, we're hearing from Selena Gomez, from the recent basketball player who talked about his panic attacks. The Rock, I think, just came out with some of his thoughts. Rick Springfield, who you guys probably have no idea who that is. That was a singer when I was your age. But I think the more that people coming out with their stories, more people will start to feel comfortable that, wow, there's these really successful people out there who've also struggled with this. It's not a badge of dishonor to have a mental health condition. In fact, if anything, it can actually help you learn how to live a better, healthier life.
I feel like it's like one of the main mottos, which is probably one of the truest things, that you're not alone going through this.
Yeah, absolutely.
Which is just, I know a lot of people definitely think, oh, I'm the only one going through this, but you aren't, and you need to get the help that you need, because it could end up ruining someone or your own life.
Yeah, that's right. And these are very treatable conditions, as I had mentioned before. So there's no reason to stay stuck in that state, you know? Sorry, that was a bit of a tongue twister, but there's no reason, you know, to live like that when there are treatment options available.
So what are those treatment options?
Yeah, so there are so many, and every person is a snowflake, so everybody is different and responds to treatments in different ways. So there's a whole range of different things. Typically a frontline first thing that's tried with especially a young person, a teenager, is psychotherapy, talk therapy, can provide relief for many students and young people even before medications are tried. That might be all that's needed to help you get through that tough time. But there are so many treatment options available, and that's best discussed with your mental health provider. Yeah.
So what are some of the other options instead of just going to the doctor or going to a friend? Is there anything else that you can do?
Or getting like medication.
Yeah, well, I mean, you know, as I mentioned, talk therapy can be huge. And there's different types of talk therapy. And again, as a person is evaluated based on what their diagnosis is, then a course of treatment is prescribed. So treatment for depression, treatment for anxiety, treatment for bipolar disorder, you know, these different types of treatments apply to different conditions, just like you would treat, you know, a broken arm differently than you would treat a gallbladder. So, you know, so there's so many available, I couldn't possibly list them all, but just know that there are great options available.
So I just like have a question. It's kind of weird, but so on the hotline that like you have for suicide, is it just like people to talk to you, or like what is it exactly?
No, I think that's a really good question, Tess, because a lot of people are like, well, if I call this number, what's going to happen?
Yeah, what do I expect?
What do I expect? So the National Suicide Prevention Lifeline number, which is 1-800-273-TALK, which thanks to Logic, who came out with the song last year, like really brought a ton of awareness to that. So big applause to him.
Yeah.
But when you call the Lifeline, you can actually call it for yourself if you're the one who's struggling, but you can also call it if you're worried about a friend or family member. And what will happen is they will quickly assess what's going on with you. They have ways of assessing that very quickly. They will then connect you with a crisis center in your county, wherever you're at. So you only need to remember that one phone number. So no matter where you are in the country, you can call that one number and they will connect you with your county's crisis center. And they will then give you advice and next steps on what to do next, right? They'll let you know whether or not you should go to an emergency room or just check in with your doctor the next day. You know, they may give you some advice and some support on the phone to kind of talk to you and help set you at ease and give you some things on what you can do.
So it's like you're talking to a real person,
Absolutely.
not just like an automated message.
No, definitely not. Yeah. And there's the phone number, but there's also a texting number. The crisis text line is 741-741. So you young folks, I know, like to and prefer to text, but if you text pretty much anything to that number, you can, the same thing happens.
So it's a real person.
It's a real person texting you back. Yeah, it's not a bot. Yeah.
So you always have a friend.
Yeah,
Yep.
there's always options. Absolutely.
Okay. Wait, so you said they can help you with a friend.
They
So
can.
How
yeah.
does that work?
Yeah, so if you're worried about somebody, actually, we just had this experience last month with some folks that are involved with our chapter. If you're worried about somebody, but they are refusing to get help or they're resistant to it and you're really concerned and you don't know what to do, you can call on their behalf and say, I have somebody here who's in crisis. What can I do? And they will actually walk you through the different options that are available to you and kind of give you that help and support. Many young people or just people in general who've never been through that before and dealing with somebody who's in crisis, that's a really good plan, is to just call them and they'll let you know what to do.
And the options tend to vary, like depending on what your symptoms are?
Yeah, they'll assess the severity of the situation, and then they'll give you advice based on that.
Okay.
Yeah.
So they'll never, like, if you call about a friend, they'll never contact them. So they'll never know that you.
Hopefully, we can persuade them to get on the phone, and you can hand the phone to them. But that's the goal. But yeah, it's anonymous. So,
Okay.
Yeah.
Got you.
All right, now probably one of the final topics we're going to get to is we focused on friends getting each other help for a while. What about parents? How is that one way that they could get their kid help?
Oh, parents have so many options, and I think, obviously their pediatrician is the first thing that they should take their child to get an assessment and an evaluation. A professional needs to be evaluating that person because they know the model and the questionnaire for determining if there's something here. And that pediatrician might refer them to a specialist to do a further evaluation if there's a suspicion that there's a mental health condition. So, and then the guidance counselor at the school can often offer support as well. So the parent should just definitely not wait because the sooner they can get the child treatment, if the child needs that help, the better. It's certainly better to address it earlier on than wait until things are in crisis.
Well, thank you for sharing all of this information with us and being here today to talk about this very tragic topic. But unfortunately, many people suffer from. No one should ever have to go through this alone. So please be a friend instead of a stranger to everyone. It could potentially save a life.
Yeah.
If you or a loved one has had suicidal thoughts, please tell a family member, friend, or call the number below, 1-800-273-8225. Together, we can help put a stop to suicide one life at a time.
Yeah.
Well, that concludes for today's show. Tess and I would like to thank you so much for coming out and talking to us.
Yep.
And make sure you tune into the next episode of The Edge to learn about more topics teens tend to struggle with.